Welcome to Aging Insights. I'm Grace Egan, Executive Director of the New Jersey Foundation for Aging. The Foundation's mission is to enable seniors to live with independence and dignity in their communities. Aging Insights is produced by the New Jersey Foundation for Aging to provide information and resources to boomers, seniors, and caregivers. Each program that we've developed over the last 2 years has a primary focus to connect boomers, caregivers, and seniors to community-based programs. There are almost 442,000 veterans living in New Jersey, with almost 320,000 being wartime vets, and they live throughout the state in every county. Today we're going to explore the various levels of compensation benefits and services that are provided by the healthcare system to veterans. Our guests today include Sue Moleon, a Veteran Services Officer and Director of the Monmouth County Office on Disabilities and Veteran Services, and Jennifer Adams-Barsch, Caregiver Support Coordinator of the VA NJ healthcare system, which is part of the U.S. Department of Veteran Affairs. We'll begin our discussion about veterans' compensation benefits. I have to say I was surprised to learn that $1.3 billion comes into New Jersey each year to family members of 528,000 veterans who qualify. These families qualify as survivors of disabled veterans or pension recipients. This is really a primary support for so many people, which is why I thought we'd start the conversation with Sue, who works in Monmouth County. Thank you both for being here today.
Thank you.
It's very nice. Sue, I know you've joined us in the past when we were talking about disaster assistance and the response to Sandy, but I was very happy that we could open up today's discussion about veteran services and assistance to those families. How many counties like Monmouth County have veteran service officers?
There's approximately 19 county veteran service offices in the state of New Jersey, but in addition to that, the state of New Jersey has veteran service offices as well. And also the American Legion, the VFW, a lot of the separate service organizations train service officers.
Would you give us a general idea what the role would be for a veteran service officer?
Well, you know, that's on an individual basis. We never know what a veteran's going to call us asking. It could be about obtaining military records, or it could be more serious about filing a compensation claim for a service-connected injury.
When we talk about veteran services, are we talking about all branches of the service? Marines, Navy, I don't want to leave anyone out, Air Force, Army, the Coast Guard, the National Guard, and the Reserves?
Yes, we are, but in addition to that, certain members of the Merchant Marines that served during World War II are entitled to, are actually considered veterans during that period of time. Not all units, but certain units that served in certain areas.
And I know we had a conversation about civilians that worked with the armed forces.
That's correct. Actually, there's an extensive list. It's pages of various civilians that worked with different agencies, both for the government and also for private organizations. And some of them, believe it or not, are American Airlines, people that worked for American Airlines who served overseas. Also civilians of the American Volunteer Group that served during World War II. Many different civilians that worked for the federal government, that worked for the Army, the Navy, the Air Force, or the Army Air Force as it was known during World War II.
That's true. That's true. And what kind of financial benefits or compensation benefits are usually available to these individuals? I know there's a range, so I thought maybe...
There is a range. It goes based on, of course, on an individual basis, but it could be a compensation claim if they injured themselves during that period of time. This is decided out of the Department of Defense. It's a little different than the VA. Veterans that served in the Army, the Navy, they get paid through a compensation claim through the VA. Where civilians, it's more geared towards the Department of Defense. That's who runs that program. I
have to confess that when we started to talk about this program, I realized how little I knew and how complicated the issue is.
Right.
So I just really want to put that out there because there's so much that we could really cover that we could do a series, but we're just going to try to focus on it today. But so There are other pensions and different things. So do you want to just explain a little bit more about them?
Sure. There's non-service connected pensions. A non-service connected pension is for veterans that served during a period of war. And they don't have to have foreign service. They could be stationed in the United States, but they served during a period of war. And it's for veterans 65 years of age or older or younger who are disabled, veterans that are disabled.
And when we talk about those that served in combat, oftentimes we think of the more distant wars, World War II, the Korean conflict,
Right.
Vietnam, and obviously we have the returning vets from Iraq and Afghanistan.
Right.
But do you see a great number of World War II vets?
We do see some. We still, mostly World War II vets are applying for non-service connected pensions. However, every once in a while we're filing a claim for PTSD or some other injuries that a veteran sustained as a result of their, their service during World War II.
You mentioned at one point that somebody might have a kidney issue or a prostate issue that's really related to their service, maybe in what they were exposed to in Vietnam?
Well, that's true. If a veteran's boots were on the ground in Vietnam, it is presumed they were exposed to Agent Orange. And once you were exposed to Agent Orange, the VA compensates for certain illnesses, and diseases associated with that exposure. It could be ischemic heart disease, prostate cancer, type 2 diabetes, but the list is very extensive. It goes on to name a number of different types of cancers. So any veteran that had boots on the ground in Vietnam, some areas of Thailand, some blue water or brown water veterans that served on the Navy ships.
What is a blue and a brown water?
Well, a brown water veteran is a veteran that served in the inland waterways of Vietnam. And some blue water veterans that were docked in Vietnam that came onshore. Some veterans are entitled to, that compensation if they were exposed to, to Agent Orange. And certain areas of Thailand. It's very complicated. The list is extensive, but we assess every veteran that calls our office.
And I know we have some links, and so we'll probably put up a link,
Sure.
which is on the compensation benefits, because as you said, it is very complicated, and I think we really want to offer people the benefit of the full picture, even beyond what we can cover today. So as a role of veteran service officer, I do get the impression that you often help people not only with their claims, but sometimes with their appeals?
Yes, well, if a veteran loses a case, if they were not awarded a compensation for their injuries, then we can go through an appeals process. But, sometimes it's a matter of just going back and looking at the claim and seeing perhaps if there's something that was missed. I mean, sometimes we have to get the service records. You have to have a link. You have to have a link between the in-service event and the current medical condition.
Okay, so let me just, I realize I didn't ask, how would someone even initiate a claim?
Well,
do they do that through the Veteran Service Officer?
Absolutely.
Okay.
That's a primary role of a Veteran Service
Okay.
Officer, is to file a compensation claim for a veteran.
And then you file it with the Defense Department?
No, we file it with the Department of Veterans Affairs.
Okay. And then the response comes back to the veteran?
And also to the Veteran Service Officer.
Okay. Which is why you then know that you have to go a little bit further, dig a little deeper?
Right. But, the idea is before you just send up a claim to the VA, you make sure you fully develop that claim. And my office and many offices in the state of New Jersey are now filing fully developed claims. And what that means is we front load the claim. We make sure that the evidence is in record, that we have all the forms filled out correctly, that we know that there was an in-service event, and we put the claim together as tight as we can and we send it up to the VA, both for a veteran but also for the VA too. We want to make sure that they're able to do their job on their end.
Right. And the same thing for family members that might come in who think they might be eligible for a compensation that they didn't necessarily file before when their veteran was alive?
Well, that gets into a DIC claim, and that's for spouse or dependent adult, even adult dependent children that relied on income from the veteran. They are entitled if the veteran dies of a service-connected injury. And also if he dies of a non-service-connected injury, but he was 100% rated for a certain amount of years, since his,
His injury.
since he, yeah, right.
Okay, so if someone broke their leg in the service because they were in a situation where that occurred, but it healed, and then they came back home.
If you're talking about a compensation claim, if a veteran hurt his leg in Vietnam, for instance, right? And he was discharged, and then years later, he's still having problems with that leg.
Okay.
So he comes to us and he wants to file a compensation claim. One of the things we do is make sure we get the service records so that we have that connection, that link.
Right. Okay.
And that usually will establish a service connection.
But the veteran service officers also work with families?
Yes.
Okay. So I just wanted to kind of answer that question. All right. Well, it is really incredible. And now we've just talked about the financial compensation. And what Jennifer's here to talk about is the VA NJ healthcare system, which was also, I think, I didn't realize the separation. And so I was really happy that you could both be here today. And can you give us, Jennifer, an idea of what is covered by the healthcare system?
Well, I want to go back and start with one piece that I think gets very confusing.
Okay.
The VA healthcare system, the federal system is broken into three parts, which includes the healthcare system, which has got campuses all across the country, hospitals all across the country. The Veterans Benefit Administration, so that's where claims generally go into. They're all things money.
Like Sue just spoke about.
So
Okay.
where many people will say VA, it's specifically the Benefits Administration that manages those claims. And then there's the Cemetery Administration.
Right.
And the challenge for many of the families and veterans that I come across is understanding just simply those pieces. That it's sometimes challenging to know who to call. And when somebody's response is, well, you send it to the VA, it's not necessarily that clear as to who that is. And I very often work very closely with the service organizations on another benefit called aid and attendance and some other pieces. But let's go to the healthcare system for a moment. So in New Jersey, we have two main campuses, one that has a full hospital, and that's in East Orange, and we have an ER, and we have a whole variety of specialties from outpatient medical to substance abuse and mental health, to inpatient units, including a spinal cord injury program, and all kinds of unique specialties. Right now, there's also a very, very special program going on called the Center for Health and Wellness, which is a new innovation here in New Jersey to make the care that's going to be done very much a partnership with our veterans and families and much less of an institutional feel.
Is that in one of these two sites you mentioned?
That is in East Orange, yes.
It's in East Orange, okay.
And hopefully, as we develop, that's a very special pilot. As we develop that further, we will help grow a new style of care for the clinics all across the country. There are 10 clinics in addition to the Lyons campus. Lyons campus does not have an ER hospital, but it has our nursing home and our palliative care inpatient unit. It has a homeless program on site, a women's treatment program on site. Just an amazing breadth of services once you begin to open the doors and look inside the system.
So there's both long-term care in terms of a facility, and then there's, I presume, in-home long-term.
In-home. And then in the home, and one of the reasons that I'm here today is that I am a point of contact in New Jersey. Each site across the country, there's 152, has a Caregiver Support Coordinator and program that helps connect our families and our veterans to those services that they can get that make the most sense for their needs. So I very often will get a call from a family who says, I have a veteran, and they tell me that they're eligible for things. So what's out there for us?
What's out there? That's what we're asking today.
What's out there for us?
And how do I access it?
And how to access that? Well, you can use the Caregiver Support Program. There is an 800 number that's a national number that's supported with social workers, and that connects, if you're from New Jersey and from the healthcare system in New Jersey, to myself and my colleague.
That's great.
If there are parts of New Jersey that are most southern or most western, they actually are connected to some of our other VAs. So those 800 numbers are a great piece to start at because they will always try to connect you to the proper facility and reduce some of the frustration of who do I call. So here in New Jersey, we have home health aid services. We have adult daycare program. We have skilled care in the home. We have a respite that you can have that's at our VA long-term nursing facility in Lyons. All of these do require that you're enrolled here in the healthcare system.
How does someone enroll?
So once you have been discharged from the military and you have a service connection, which Susan was talking about.
World War II or you're a Vietnam vet or a more recent conflict.
So those that are getting some sort of compensation can enroll. You can enroll online. There is an 800 number for enrollment. There is also a way to do it online, to start an application online for enrollment or to download the forms and you can bring them into your VA. If you're service connected, you're going to be able to get into the healthcare system. If you have low income, there are categories of veterans that can come in, but they have a copay. Somebody that maybe also can get in is someone that had a catastrophic event happen in their life. Maybe it's not specifically something that happened as a result of the military, but it's significantly changed their health condition. There are special categories for those. And that is such a complex issue that those eligibility folks are a fabulous resource. And there's a special 800 number that you can use where you can actually have somebody walk you through the process. And if you're not somebody who can fill out forms yourself, they can help you fill them out online, send them to you to sign, and then you attach a form called your DD-214, which is your discharge papers from the military.
Okay. So, in terms of being applying for eligibility for the healthcare system, it's not something that the Veteran Service Officer would necessarily do because they're doing the compensation benefits.
Correct.
Is that correct? Okay, so whether it's the 1-800 number or whether it's actually contacting one of the many sites in New Jersey.
Right, and very often I'll help start that process because very often somebody will be in the hospital and they'll have an event that's happened in their lives and now they're trying to figure out how to sort through all these pieces. And so the caregiver program can very often be that first point of contact so that the families and the veterans can start to figure those things out. And that's very often the time I also connect them to the service officers and we start looking at claims.
Right. I think what's interesting is the fact that there's so many services under the community care program. And I think even on the phone you mentioned that there are a variety of people that go into the home.
Yes.
And so maybe you could touch on those services.
Sure. There's a program called the Home-Based Primary Care, and Home-Based Primary Care is actually right now something that we're expanding. We have a lot of rural communities here in New Jersey.
Yes.
And so we have teams, and that'll include a nurse practitioner, a social worker. It can include your skilled care, home health aides, whoever would be appropriate, and they would come out to you. So if a veteran is unable to get out of his home because of his health conditions, we can still provide those care services to them. And as a social worker who worked in the community, it was very hard sometimes to get doctors to come out. So this is an opportunity to really meet a need, and certainly our veterans and our caregivers out there are really benefiting from that.
And does that include hospice and palliative care in the home?
We work with community contracts for the hospice. However, they can come into, we have something called Promise House. Promise House, it's our promise back to our veterans who bear the burden for our country. So Promise House is an inpatient hospice that we have, and that is located at the Lyons campus. We do take people evaluated from the community or from the local hospitals as well as from our VA hospital here at East Orange. And we do have an entire team that works with both our geriatrics and our palliative care. So there is palliative care services in addition to hospice. So those that aren't quite in need of hospice but may be becoming much more ill.
And need pain management.
And pain management, comfort care, yes.
I think it's a very important issue. I know that when we originally talked about setting the program up, you were mentioning that November is Caregiver
Caregiver Month across the country.
Across the country.
Yes.
So maybe you can touch on, you know, we've talked about the veteran that receives services, but how do you serve the families, the caregiver family?
So about 2.5 years ago, the VA started the Caregiver Support Program, and the design of the program is to provide an 800 number with referrals. We also have a website, which is the www.caregiver.va.gov. On there you find a wealth of resources, whether it's educational materials or tools to help keep you organized as a caregiver.
What does that mean?
That means things
we all
like
need to
medication.
be organized.
There's resources on there for how to manage the medications and to how to put them in a structure that you can take with you. There's incredible amount of additional resources on there, which I see as great portals to get to the resources. It might be on brain injury or dementia or stroke or different kinds of things. There's a geriatrics website that we have, and there's tools on trying to sort out shared decision making for our caregivers and veterans, trying to figure out what decisions as they become older and their health changes that they want to put in place.
And what the family can do
and what
together.
the family can do to sort that out. Just an amazing amount of tools. In addition, we now have, there's a newsletter for caregivers that you can sign up for, that's quarterly. There's telephone support groups for the caregivers that they can enroll through my office to provide support. Those are educational groups where they can call in from any phone that they have, and they can get connected and hear what other things and other caregivers in the veterans services are using.
You can see why I thought when we started this discussion, you know, prior to setting up the show, how complicated and how sophisticated the systems really are. And I can see that a veteran not only needs in many instances, not only the compensation and the financial support, but also the support that is they can access through the healthcare system. So I'm guessing that you frequently see a blend in terms of servicing a veteran.
A blend not only of ourselves,
Right.
but there's other organizations, both private sector organizations and other parts of New Jersey Military and Veteran Affairs. There's a wealth of benefits that are specific to New Jersey that don't have anything to do with the healthcare system, but very often you want to make sure you've opened all the doors and shown them how to connect.
Well, let's offer some examples in terms of, you know, things that our viewers might have experienced for themselves, but what you see in terms of clients that you see this blend of services really helping.
Well, when, oftentimes a veteran will come into my office and they want to enroll in the VA healthcare system. We can do that from our office. We have the forms. We will sometimes help them fill it out. Sometimes we'll give it to them and they'll take it home.
So you can't do it, but you can help them get all the paperwork
Well, actually,
together.
sometimes we actually will put it together and we will fax it right to the brick clinic. I mean, we do that, you know,
all the time.
fairly often. So, you know, that's a blend of services. We also use New Jersey Department of Military and Veterans Affairs. They have a contract for psychological counseling for veterans, and I have a lot of veterans with service-connected PTSD, and we're able to use the state contract to assist veterans because there's a few locations in Monmouth County and the veterans don't have to travel far. They could stay right in Monmouth County and receive the counseling they need.
Yeah, I think that's important. I know I was going to ask if the VA or whoever provides transportation when someone needs services, and I don't think I asked that. But you offer so many in-home services, maybe transportation is not an issue. And I know the counties have transportation programs, but not necessarily targeting veterans.
Well, our Monmouth County actually a few times a month goes up to Lyons and goes up to East Orange. In addition to that, the VA actually reimburses veterans for their, you know, if they're going up there for a C&P exam, compensation and pension exam, if they're traveling from South Jersey or anywhere, and they have to go up to East Orange, they'll be compensated for that.
Oh, that's really helpful to know.
And the VA has shuttles that go between East Orange and the Lyons campuses, as well as the Brick campus. I have found that a lot of the county organizations have specific dates that they work with transportation. And the VA healthcare system, if you meet certain criteria, service connection, and you have certain medical needs, there are, whether it's a van or a bus or even sometimes an ambulette, there are ways to use transportation. A lot of the things with the healthcare system all start with your doctor at the VA. And while you may have a doctor in the community, if you want to access things within the healthcare system, you do need to see a doctor at least once a year.
At the VA.
At the VA. And they don't have to replace your doctor in the community. But you need to do that so that we can help coordinate your care. And it can be an amazing group of services, including your pharmacy or even incontinency supplies or equipment or different things. So it certainly is a connection that we need to all work together to build a strong foundation for our veterans and families.
And I would imagine that since you've both been doing this a while, that you can really see the difference of putting this package of services together.
Oh, absolutely.
Yes.
And I think that's probably very rewarding for you both, as well as for the families and the veterans that you work with. So I think that's really, a very outstanding thing. It's nice to know that it's such a complete and comprehensive service. One last thing.
There is amazing technology right now that lets us stay connected.
That's great.
And whether it's a website, whether it's the VA on Facebook, the technology to really get us to clinics and things with all of those services, you would be surprised as how much you can do.
Thank you. I'm just very pleased that we could do today's program. And today's program was sponsored by Parker Adult Daycare, an affiliate of the Francis E. Parker Memorial Home, which is a nonprofit long-term care provider servicing seniors in New Jersey since 1907. For more information, please visit www.franciseparker.com or call 732-565-2400. I would like to thank our guests for sharing their time with us today. To become a sponsor for Aging Insights programs, please visit our website or call our office. We want to remind you to find out about senior services in your area. Please call the state hotline at 1-877-222-3737. Or you'll see a listing of county services on our website. You'll also see a survey there about Aging Insights. Feel free to share your comments with us. Thank you for watching this episode of Aging Insights. And remember, aging is everyone's business.